This is Dr. Roger Knapp, pediatrician. Let's talk about warts, common problem in kids. And no, you don't get it from playing with frogs. They're usually in trauma impact points such as the hands, knees, elbows. And there's different kinds of warts. We won't talk, nor do we recommend you treating warts around the perineum area. These warts on our extremities, they're easy to treat. And you can get the compound W materials and medicines over the counter, but that contains salicylic acid, which is aspirin, which most people don't realize. And in the old grandma days, they actually took a chunk of aspirin, moistened it, put it on the wart, and put tape over it. But we now have the liquid materials, so compound W's work. It takes quite a while to treat them, but if you keep putting it on there, it'll get rid of them. They also have some freeze-off, minor freezing devices over the counter. Not real effective, but you can sure try them. We physicians have a little stronger freezing materials, but even in our really stronger freezing devices, 50% of them will come back. So sometimes you have to come back and refreeze them. My favorite question to ask the parent, though, is who's this really bothering, the kid or the parent? If the child doesn't care about the warts, eventually they go away. It may be several years, but they will eventually go away. Usually with prolonged soaking, many a kid comes back from the water park or the lake, having spent there all day, and come back and there's a hole there where the wart was. And that's another way to treat it is with duct tape, putting tape around the joint, finger and stuff, and it gets real white and friable, and that's the way the wart will come out of there. And I think that's similar to the prolonged soaking. The sweat underneath the tape kind of gets it very friable and it comes out of there. The warts on the bottom of the feet, plantar warts, and on the palms, very difficult. I don't even treat plantar warts on the bottom of the feet. I tend to send them to the podiatrist. They're tough to get rid of. But these ones on the top, if they're not bothering the child, leave it alone. But there's other ways to just try and treat it with the compound W's or duct tape. It takes several weeks, if not a month or two, to get rid of it with compound W or duct tape. But you certainly can see your physician, and we can do a little bit stronger freezing job on it. Thank you. This is Dr. Roger Knapp.